Good afternoon, and welcome to this webinar on COVID-19 and challenges to the Orthodox Church. My name is Tony Kyriopoulos, and I am Associate General Secretary at the National Council of the Churches of Christ in the USA. On behalf of the National Council of Churches, I am honored that the NCC is presenting this webinar in partnership with the Orthodox Christian Studies Center of Fordham University. I am particularly pleased to be able to convene this program with the center's Aristotle Papanikolaou, whom we know as Telly, and George Demokopoulos, and also with two other co-conveners, Father Peter Bactus of the Orthodox Church in America, and Father Nicholas Kazarian of the Greek Orthodox Archdiocese of America. Both the NCC and the center wish to thank the Greek Orthodox Archdiocese for hosting this program on its Zoom account. I will note here that we are recording this session and that it will be available for future viewing later. COVID-19 is no less than a modern day plague. As of today, almost 4.4 million Americans have tested positive for the disease, and more than 150,000 have died. Worldwide, almost 16.8 million people have tested positive, and more than 662,000 have died. And even with talk of flattening curves and promising vaccine trials, there is no end in sight. Christian churches and other communities of faith have responded as best they can to the challenges posed by this pandemic. These challenges, some common and some unique to each community, for some people go to the root of faith. Where is God in all of this? The pandemic also presents daily challenges, social, humanitarian, pastoral, to which all communities are struggling to respond. This webinar will highlight some of the Orthodox Church. A future jointly sponsored webinar to be held within the next couple of months will look at COVID-19 and ongoing challenges to the ecumenical community. To help us understand the challenges and responses within the Orthodox Church, we have three excellent presenters. They will help us to evaluate scientific facts surrounding the pandemic, navigate particular challenges that impact local, national, and international church communities, and learn about some of the church's joint responses so far and opportunities for collaboration in ministry on the horizon. After all three presentations, we will have a discussion that will focus on questions from all of you. With this in mind, please send your questions to the Q&A box. It's on the bottom of the screen, the Q&A box, and we will try to get to as many of them as we can. Thank you for joining us in this conversation. I'll now turn it over to Telly Papanikolaou, who will introduce the speakers and presentations.
Thank you, Tony. My honor to introduce the speakers and to be a part of this program. We have three very esteemed, very faithful, very active participants in the Orthodox Church. We're going to keep the introductions kind of short and sweet so we can maybe get to the program and get to the questions, since we're only here for an hour. But all names are very Googleable, and you can find a lot about their work, their publications, their activities through a simple Google search. But I'll begin with Gail Wallachak, good friend, and just simply, she wanted to be introduced as professor at Northwestern University. I guess there's really not much more to say, right?
Exactly.
And then there's, of course, Nicholas Anton, who's the Director of Operations, Director of Operations of the Assembly of Canonical Orthodox Bishops of the United States of America, and previously served as Greek Orthodox Archdiocese of America as the Ecumenical Officer and Representative to the United Nations. And of course, there's Reverend Dr. Nicholas Denisenko, who is the Yoakum Chair and Associate Professor of Theology at Valparaiso University. Now, we've asked each of our panelists to just sort of begin with some brief reflections, mainly centered around the question of what they see as the biggest challenges that COVID-19, the coronavirus, this whole time period has really posed to the Orthodox Church. So why don't we begin with you, Gail, if you want to sort of start us off, and then we'll go with Father Nicholas Denisenko, and then we'll end with Nick Anton.
Great. So I'm not going to spend a long time because I know we want to leave a lot of time for questions, but the comments I would start with are, we all know how difficult COVID has been and the changes that it's made in our lives and the loss of loved ones, the debilitating situation that's happened with regard to jobs. But I think it's provided some very unique challenges for faith-based communities in the US and even worldwide. Where I view it as being very challenging is that it's actually made us consider what we think about science and how we view science within a church context. I think the spectrum of responses from most religious communities inside the US and abroad has been very wide-ranging. Some communities have totally ignored epidemiological evidence. They've continued to have church services unchanged. They've protested the fact that they have to wear masks or that there need to be changes in singing and even questions about how communion and shared spoons should be used. And others have jumped up to embrace the science and have said, look, we need to reconsider how we're doing everything. I think you can find Orthodox parishes that fall in the entire spectrum from there. I think for me, what was shocking in this situation is I actually believe that the Orthodox Church was generally embracing of science. And I did not expect there to be such difficulties, particularly when people's lives were at stake. What I expected to happen within the Orthodox Church was that the churches would easily close when we were asked to do so by our healthcare providers, that we would see people coming back to churches easily wearing masks, chanting in masks, holding liturgical services in masks, and for communion, using multiple spoons for communion instead of a single spoon. This was not what we found that happened, at least in all parishes, and certainly the hierarchical response has been extremely mixed in that regard as well. And so for me, it has been a time of great frustration to see the church denying scientific evidence when I never expected that. That's all I'll say.
Okay, very good, Gail. Just as a reminder, Father Nicholas, before we get to you, just as a reminder to everybody, please use the Q&A function. We want this to be as, give as much time as possible for discussion and for your questions. So you do have the Q&A function there, and we encourage you to submit your questions. So Father Nicholas, go ahead.
All right, very good. Thank you very much, Telly, and thank you for the invitation to contribute. In the spirit of brevity, I will limit my remarks to a few things. I think that Gail has already brought up some of the big issues, and I'll go a little bit further into the question of what happened liturgically. I want to begin, basically I want to just touch upon 3 points. The first is resistance to altering the method that's used for distributing Holy Communion. The second is the insistence on attempting to fulfill the obligations of the liturgical tradition, despite the parameters that are necessitated by the pandemic. And I want to just briefly touch upon what I think is an opportunity for Orthodoxy and perhaps for all Christians that perhaps we've missed so far, but it's not too late to do that. Without going into the details, and we can go into some of this if we wish in the Q&A session, Gail referred to the use of spoons for communion, and if there's anyone participating that doesn't know, since about the 11th century, introduced before that, the main method that the Orthodox Church uses for distributing communion is a common communal spoon. Now, within church circles, there have occasionally been questions raised about whether or not this is safe, whether or not one can catch an infectious disease from a shared communal spoon, and for two reasons it never really became an issue to the degree that it is now. First, because for most of the history of Orthodoxy, communion was rare. most people didn't go to communion except for about once a year. And that didn't change until the mid and latter part of the 20th century for at least part of the Orthodox Church. And second is that the cup that we use for communion is filled with very strong wine, boiling hot water, and metal properties. And even studies that have been done that have studied communion cups in the Western churches have showed that it is very difficult for one person to catch, not impossible, but difficult for somebody to catch something if there's a shared communion vessel. But obviously with COVID, it became an issue not only because we all use the same spoon, but also because it's impossible to distribute communion to another person and maintain 6 feet of separation. And so this became perhaps the most important point of contention within the church. And there were a variety of schools of thought that revolved around this particular point. To briefly summarize, one school of thought said that if we consult our history and consult a broader view of tradition, that there are other methods that could be used to distribute and to share communion more safely. Another school of thought essentially said that it is an article of faith that since Christ is truly present in communion, it is impossible to ever catch anything that would be threatening to the human person. Now, the phrase article of faith is very technical terminology. This suggests that this is a very high level of theological teaching. And so it became a contentious point. And the reason that I think it's important, and this is what the main takeaway on this particular point, is that most of the energy within the church was devoted to debating this issue, not only on social media spheres, but also really within the church. So for example, in Moscow and in other places, when they introduced the practice of having some kind of a grain alcohol available to dip the spoon in between each communicant, people began to complain that that alcohol was getting into the cup and that was making them not feeling well. So what we have here is a real rush to defend the status quo, to not change anything, to make sure that we preserve tradition untouched despite the threat that was posed by the pandemic. Similarly, in the second example, we also have COVID really exploded with Holy Week and Easter or Pascha for the Orthodox Church. And really the main outcome for most of the churches was to have a minimal crew of people that observe the liturgical ordo in the church while encouraging all of the other people to participate via a live stream on Facebook or YouTube or on some other digital meeting space. And so again, this kind of fits in a similar vein to the question of the communion spoon. Change as little as possible, make sure that the requirements of the liturgical order are fulfilled, and have people participate via watching, which raised a whole number of questions and certainly satisfied a large number of faithful who missed the opportunity, and to this day missed the opportunity to participate regularly in the liturgical life of the church. But again, what we have here is a lot of energy devoted to maintaining the status quo as much as possible with as little change as possible. So for example, when it became possible to have divine liturgy again, there wasn't a whole lot of discussion of, for example, is there an abbreviated version of the liturgy that contains all of the essentials that could be done in 30 minutes with minimal singing? Instead, we have a limited number of people who could come. And I think that it's important to emphasize that those who invested the time and the energy into planning for a safe liturgical gathering did so remarkably well, and certainly with good intentions and in the hearts in the right place. But I think what the big question is that remains to be asked is there another way to be communion? And in this, some of the questions that have surfaced that we have an opportunity to address is liturgy the only purpose for gathering for church? Or is there a greater purpose that is beyond us? If we were to list our core values, would it say that gathering for liturgy is the most important thing? Or is there something more? Is it most important to receive communion regularly because we've been taught that we're supposed to do that? Or is it more important, as Father Alexis Vinogradov has said consistently, to be communion, to be present, to share the kind of communion that is needed with other people at this time? And so the third point is, I think that there has been an opportunity present all along to reimagine what it means to be church. And that opportunity may not be limited to the tight parameters that have been necessitated and demanded by COVID-19. It may also be speaking to larger demographic realities that are at our doorstep and really coming through our doors right now. To this point, it may be that that opportunity was missed, but I think that there is still a lot of time to embrace the opportunity to reimagine what it means to be church when we simply cannot function, when we simply cannot gather in the ordinary, customary way that we've become so used to that we'll defend it really to the ends of the earth. And again, in the spirit of Gail, even though I talked a lot longer than you did, I'll stop now so that we can devote more time to questions and answers. Thank you very much.
That's great. Okay, now we'll turn it over to Nick Anton from the Greek Orthodox Archdiocese.
Good. So I'll add. There's not much to add. A lot of great things were said by Gail and Father Nicholas. But I'll say from the assembly perspective, it was really taking all these challenges that were mentioned and trying to figure out how to respond to them. And the greatest, I would say perhaps in the beginning, the greatest challenge was you have this separation. We have to be safe and have the separation, but how do you still minister? How do you be together as community? And I think the questions that Father Nicholas is posing are exactly that. You know, how do we take this holistic approach? You know, I don't think there's one or the other. It's not that we can go away from being liturgical, which is sacramental, which is a very tangible thing, and the sacraments that happen, you know, in a tangible way, and that was discussed in the very beginning by the bishops. And then there's also the need to be safe and follow the science as well, and have this synergy between the two. So that was a big challenge for the beginning, in the beginning with the bishops and with the assembly, trying to figure out how do we respond to this. And as things went on, it became the issue of how do we safely reopen parishes when it comes to whether it's numbers, whether it's the communion question, or otherwise, how do we do that? And then there was, of course, a third twist, which is in a lot of ways and perhaps because of our compliance in the beginning with all of the regulations, as we went to the reopening phases, we began to see a lot of government overreach, and the church had to respond to that. So the idea, not that we shouldn't be safe on how we reopen, but considering churches the same as movie theaters or restaurants, that we're just an entertainment type of a venue, and we don't, rather than giving us our rights that we have, which are way beyond all of those things, the same rights that protesters have. We have First Amendment rights. It all fits in the same. So to see plans where churches were included at the same level as a restaurant, or not even as restaurants, really as movie theaters in the final phase of reopening, the church ended up having to respond to that. So there were levels of challenges and levels of complications all the way across the board. I think, as far as response is concerned, I'm sure we'll get into that throughout the discussion. But just to mention a few, when this first began, the Executive Committee of the Assembly of Bishops decided that it would meet every single Friday, and it still does to this day, to try and coordinate across the Orthodox world how to respond. Of course, within Orthodox, you have a strong sense of unity and diversity. So we never want, the Assembly never wanted to believe that it had any authority over any jurisdiction. So each bishop, of course, was going to respond however he wanted to, but rather than have wildly diverse responses, we decided to convene a COVID-19 task force that was advising both the Executive Committee as well as all of the bishops, all 52 bishops across the United States, who could then take that and apply that to their local area. And so that's why you'll see, some diversity in response, but you'll see a pretty strong adherence to different guidelines, and whether that was closing or reopening or pastoral visitations or any of those types of things. Another big thing that was done to go straight into, to help the parishes out and to help the laity out was our COVID-19 Resource Center. So I want to say it was very early on, maybe March 16th, 17th, we launched our COVID-19 Resource Center, which pulled together all the resources produced by all the different metropolises and jurisdictions across the country to try and find the best resources and get it into a place where parents could educate their students when they were doing their homeschooling using Orthodox resources and things of that nature, whether it was liturgical texts online or instructions for parishes to set up live streaming, QuickBooks and financial resources, because that was a major strain on the church and on the parishes. We're in a model, at least we're in a model where we got our income from people passing a basket around. How do you do that when you're watching it online and you're not partaking in the sacramental life of the church, but you're still participating as the body and supporting as the body. So trying to help parishes through that. Then one of our greatest accomplishments too is the Parish Reopening Toolkit, where you can go to this toolkit, put in your zip code, and in the beginning, now it got a little complicated, so we aren't able to provide the legal analysis. We had a team of lawyers in the beginning that when you put your zip code in, it would give you your state laws that you had to abide by, but it would also, in a separate part, would give you your county level data as far as the curve. So rather than the jurisdictions, the bishops, the parishes, the priests having to go to all these various resources and try to figure out the epidemiological data on their own and then create a curve, we were able to have help from medical professionals and public health professionals to create an algorithm that was able to do that for our parishes, our people. So those are just a few ways that we try to respond to these various complications, but I'm sure we'll talk about that more later. So I'll let the conversation begin.
Thanks so much. I wanted to maybe go back to Gail just for a second, Gail. I mean, I think we have a lot of broader issues here having to do with sort of a coordinated effort by the Assembly of Bishops, looking at some of the sort of ways of thinking of our history and our theology to kind of broaden our sense of communion and what that means, or just broaden our sense of what it means to be Orthodox, actually, and to live it and to embody it. And then, Gail, of course, your very challenging question, which has always been a challenge to the Orthodox Church in general, and just in terms of when issues like this come up, it just provokes these challenges of thinking about our faith in relationship to science. But obviously, the multiple spoons issues and the communion issue was somewhat central to one of the challenges, anyway, that we face. And I think I wanted to just ask you a clarificatory question about this idea of transmission of disease, right? In other words, that the Holy Communion can't transmit disease. But a virus technically isn't a disease. Is that correct? Am I accurate on that? I mean, we had sort of on public orthodoxy, I mean, to plug our own sort of electronic publication of the center, Hermina Nadalescu's wonderful piece. But even before she wrote that, Father Cyril Havarun, who's not a scientist, but basically made the same point and tried to connect that theologically in public orthodoxy. I feel compelled to ask that question and to have clarification on that, because a virus technically isn't a disease, really. I mean, it's in that sense, if that's the case, then really communion isn't communicating a disease per se. It's communicating something which, when interacting with other factors, actually, starts a sort of cascade of events that ultimately, a complex of events that ultimately we identify as disease. Is that correct?
Yeah, I mean, what the virus that does cause COVID is what can be transmitted from person to person. Does every person that get that virus get the full-blown COVID? No, in fact, that's our problem, is that lots of people are walking around asymptomatic, never develop the full disease, but are still infected with the virus and we don't know it. So what would be passed in the communion cup is the virus, theoretically, not the disease itself. So the virus causes disease, but not in every person.
Okay. That creates all kinds of theological questions in terms of the relationship of religion and science, or our faith in science. But perhaps we'll go to, we're getting questions coming in, and then maybe Tony and I will go back and forth in just terms of handling some of these questions. But we have actually one that actually relates to Nick Anton's sort of informing us of the many steps that have been taken, especially by the Assembly. And the question is, what would you recommend as the best source to use to garner and assess the most up-to-date and accurate scientific information on COVID? So this would actually go to Gail, I think. And then this one, I think, goes to Nick. It's a two-part question. Is there an agreement among hierarchs in the US, especially with the Assembly, on such a common data source, right? So Gail, I mean, can you answer that, maybe that question about
so
data source? And then Nick, you know, have they been using a common data source? So yeah.
Yeah, so it is so hard. I mean, the Johns Hopkins site is the site that gives probably the best used data set for infectivity rate, for who has the infections, and for numbers. So from an epidemiological perspective, the Hopkins website is the best. But the problem is that the science is a moving target. And the way science works is somebody does an experiment and others replicate it. And there is a lot of work on COVID that's getting into the literature that hasn't yet been replicated. So therefore it hasn't undergone full scrutiny. So it almost needs, you know, constant honing of the data and honing of the results to glean the absolute what's going on from a scientific perspective. I sponsored a conference last week on COVID and radiation, and there was total disagreement on the same data on what is really happening in those patients. So it's a moving target, and it's hard to point to one place.
Nick, you want to go to part two of that one? Yeah.
Yeah. So I'd say the short of it is it's using that data. I mean, it's using primarily the data from Johns Hopkins. I believe there's 2 data sources though that are used in the algorithm that creates these things, and that's in the COVID-19 Parish Reopening Toolkit. So if you were to go to the Assembly of Bishops website, assemblyofbishops.org/COVID-19, there's a big red button. This is the resource center. In the top of the resource center, there's a big red button that says COVID-19 Parish Reopening Toolkit. And then once there, there's a little button that says click here for new case trends. Within that, you type in your zip code and it brings you into your county. And so I know a lot of the hierarchs have, because it was produced by the Assembly by this COVID-19 task force, which included lawyers, public health professionals, risk management people, priests, and other pastoral care professionals. It's chaired by Metropolitan Gregory. They put a lot of work into this, and they made this tool where it's very easy for parishes to just type in their zip code and kind of figure it out. So different bishops have done it different ways. Some have been telling their priests, each individual priest to use this toolkit every week on Thursday, kind of figure out what they want to do Sunday. Other bishops have been using themselves and then telling the priest. But I would say a lot of the bishops that I've spoken to have decided to use this because it's just an easy way to get to the data. If you go to a lot of these websites, it's a little bit harder to figure it out for a very specific region.
So, if I may, Father Nicholas, a couple of questions have come in, and I'm going to kind of conflate the two. One asks about the whole discussion, controversy about the spoon, and whether that whole conversation revolves around fundamentalism and a fundamentalistic understanding of things. And then I guess the way it's connected to the next question, another was, should the pandemic be thought of as creating a theological crisis, or is it a faith challenge? Is it something that goes really to the heart of the faith, or is it really more of the church's, the faithful's faith in the things that the church proclaims?
Thank you. About the spoon, I think there are a number of different ways that we could describe why there was such resistance to wanting to find a safer way to do communion. It is not unusual for any religious community or any community that has rituals to want continuity, to want to pass on what they already know. The introduction of the spoon itself, historically speaking, which is something we simply take for granted because it's all we know, is something that was resisted when it was first introduced, and it took some time for it to become established in the Orthodox Church. And that's true for any number of liturgical traditions that we see them as being normal, and we can't imagine being without them. A lot of these traditions evolved for reasons, for like a combination of phenomena, things that simply happen, whether it's a shortage of people to help to give communion, or simply the fact that the chalices that were once used were ceramic and weighed a lot more, and you had to have somebody who could actually hold it to help somebody give communion. Whatever the case was, anytime that we introduce a new tradition, we tend to be averse to the whole notion of adaptation and innovation. And we also tend, and I think that this is probably part of a discussion that we could take on at another time, we tend to look at tradition as that which we know, without having a much broader look at history. And so if that's fundamentalism, and I think fundamentalism is not in perfect alignment with what I've just described, one might be able to see some notion of fundamentalism there. But even now, it's possible to receive Holy Communion differently. Let's not imagine that members of the clergy are outside of the church, or out there, or so different from the laity. When clergy receive communion, they receive it in the traditional way, the one that preceded the use of the spoon. Communion in both kinds separately, the clergy receiving the body of Christ in the hand and drinking from the cup, which was the customary manner for communion prior to the introduction of the spoon. So what I think is important here is that if we're going to talk about this, that this be a discussion that takes place in the church, openly and very patiently, with as much grace as is possible. And as for the second question of whether or not this is a theological crisis or a matter of faith, I would lean towards the second one. I think that anyone whom you might ask or query about this might say, no, there really is a theological crisis at stake here. The issue that I think is most important is the question of what is the church? Where is the church? Now, we have all kinds of ecclesiological literature and experience that tells us where the church is. The church is where we gather, right? And that's why this has hit home so much. This is why when America began to, quote, open up again, people rushed to be able to have a picnic or a meal with friends or family. And this is why people want to come together back in the church. It's part of the social fabric of being human. So it's not at all unusual for us to want to gather together. But I think the challenge here is there a way to do this, to maintain this, to sustain it, and to even strengthen it, that can be accomplished within the challenging, difficult parameters that are demanded by COVID-19, demanded by physical distancing, demanded by having to have only a certain number of people in an indoor space at a time. So for example, and I'll just give one, on any given Sunday, if you have a divine liturgy, would it be possible, if you had clergy available, for someone to lead a typica service with communion that was separate from the divine liturgy, so that more people could participate? And I give that example because I know that it's happening at least in one place, and certainly more. So sometimes we need to stretch our imaginations and draw upon the larger great river of tradition in such a way for us to understand that liturgy itself is not the means, but to be communion, to be together, to be present, not only to our fellow Orthodox Christians, but also to others in the community, is truly the, among the top in the list of the core values of what it means to be Orthodox.
Thank you.
So the next question I'm going to throw to Gail. So Gail, I'm going to give you this question, then I'm going to have a quick follow-up right after that. Okay, so let's do this one first. But, you know, why are the churches treated as movie theaters by the government in terms of COVID restrictions? I mean, given your sense of the science of it all, I mean, is it just about gathering in an enclosed space, right? And what about the use of incense to carry the virus? Can incense actually carry the virus?
Yeah, so let me answer the first question. The reason why the churches are treated in that way, actually, there are two places that have proven to be the most infectious generating areas of all. One is a church, and the second is a bar, okay? So we are not being treated like bars, which is about how infectious churches are. In most of the US, much indoor drinking in bars is closed, but churches are left open. And movie theater is actually much less infectious because there's normally a broad open space that people are in when they're viewing. So that's not considered to be so bad. But again, it's not considered to be so essential as churches are as well. So, you know, I think if you thought about it from an infection perspective, you would think about a church as being like a bar. The second question is, can it be spread by incense? And right now, there's no evidence at all that it could be spread, that it infects or can get into the incense and therefore could be spread otherwise. To have the virus on any surface at all, you know, it doesn't survive that long on surfaces, and there's no evidence that it would survive on the surface of incense. I mean, nothing's been done to test for it either. And I need to mention one other thing, just so everybody is aware. Teva Regal from President of OTSA reminded me, there's a survey going on right now by the Orthodox Theological Society of America, surveying clergy to find out what the practices are in your parishes regarding COVID and how it's been handled. So please, if you see that survey, please participate in it.
And the Orthodox Theological Society of America is actually going to hold a webinar also on August 22nd, Saturday at noon, on science, COVID, and our faith. And I wanted to ask you about that, because maybe to expand a little bit on your opening comments. I mean, there's these things that happen in our church that provoke this science and faith discussion, because it lays dormant and then all of a sudden kind of gets provoked in some particular kind of way. We had it with the AIDS crisis, we have it with COVID, sometimes with issues related to evolution, as we see in Russia and in Serbia. But, you know, what's interesting, and I could be wrong on this, but I don't think I am, but this science faith thing is really a post-16th century, even frame it that way, as this kind of issue that provokes this science faith discussion is really a post-16th century kind of phenomenon, right?
Absolutely. I mean, you know, the Orthodox Church has gone hand in hand with science. In fact, many of the early church fathers were scientists and made scientific observations. So this division between church and science, I never saw as being something that was orthodox.
What would you like to see? In other words, what would you like to see? How would you like to see the church move in a particular direction in terms of this particular relationship?
Well, I think what I would have liked to have seen, for instance, in this example, would have been more consultation between scientists and the church about what would be the best ways to handle things in this situation. More parishes that involve their scientific and medical communities and approaches that should be used for protecting themselves against this. More dialogue between scientists and clergy about how best to handle this. I mean, I don't expect my priest to understand all of the COVID literature, nor to have read it, but I do expect that I've looked through most of it. So why not bring together people that know what's best to do on both sides and go from there? I mean, I'm not criticizing, my priest has actually been wonderful in all this, and we have met frequently, but that has not happened in many, many parishes.
Do you feel that, and then I'll hand it over for Tony for another question, but do you feel that the cultural wars gets in the way of the churches?
Yeah, for sure.
Taking seriously
today's
science
cultural wars.
input?
I mean, I met with a group of clergy last week, 6 clergy, and every one of them felt as though the political situation in the US has made it be much harder for them in terms of dealing with this crisis. One has a parish where nobody will wear masks in the parish, and having them wear masks is a big, big challenge for him, much less talking about communion issues. So the cultural wars that are going on in the country are, and I think broadly in the world, but certainly in the country, are really affecting us.
And making it difficult to just simply listen to the scientists, right? I mean,
Yep, that's exactly right.
Yeah. Okay, thanks.
I got two questions for Nick, Nick Anton. One is looking ahead at future pandemics that scientists are saying are bound to arrive. And many of them might be worse. Are bishops and church leaders so resistant, as Gail was talking about resistance to science, or would it be helpful for theologians and scientists and others to get together and create a document for submission to the church that with recommendations, liturgically, theologically, scientific, for future outbreaks? Would that kind of thing be helpful? And the second question, I'll go ahead and then I'll just ask, it's not related to this, so then I'll just ask you.
So I think, I mean, and again, this is sort of at the executive committee, the Assembly of Bishops level, so it's the heads of jurisdictions, but even through this pandemic, the COVID-19 task force did bring together about 3 very high-level public health professionals, all these lawyers, all these risk management people, and there were a lot of recommendations that, and they're on the website of the Assembly of Bishops, risk reducing measures, statements from the beginning where the church, responded based on the science. So I don't think it was a complete loss. Again, each bishop is going to implement how they want it on their local level. There's nothing from the macro level that can be done about that in the Orthodox Church. We're a local church. But I think on that level that's there, and now that this course exists, we put it together very quickly. We can expand it and we can keep it as something that we can tap into for any future pandemic. But I don't think in my experience sitting in on the executive committees and taking the notes there and everything, there wasn't a resistance, at least from the heads of jurisdiction level, to the science. That's part of the reason they were very strong on shutting the churches in the beginning. As just like the protests went on, I mean, if churches really wanted to take legal action and say, we have First Amendment rights, you can't close us, there were avenues that could have been taken, but churches wanted to, at least from the conversation I was part of, they wanted to continue, they wanted to listen to the science and do the right thing. On the later side, and I want to clarify a little bit too with the being treated like movie theaters, it was a matter of not saying, you should let us reopen 100%, but it was a matter of saying that if the government is going to put restaurants before churches, which have no First Amendment rights, you can't. It's from a theoretical stance, but you can't do that. This is why and it was only I should say it's only a few states. I want to say it was like 2 or 3 that we had to write to, and it was in consultation, like Washington, California, and others, and many of them switched right away. I think the only state was Washington State that continues to give us a hard time. And even later with communion, a number of states that were going to try and dictate how communion can be given. I believe Washington State is still the only one that has not changed their legislation and protocols. But overall, the actual response and what bishops are doing on the parish level, they're trying to take the science into account and maybe not to where it needs to be, but maybe it is a step in the right direction. And hopefully it's a step in the right direction for these future instances.
Thanks. So now the second question is, are there any examples as to how hierarchs are supporting clergy with regard to mental health during this stressful time?
That's a good question. On a specific level, I'm not quite sure because that'd be sort of outside of my mandate. This is something that the chancellors of each jurisdiction will be dealing with and with the bishops. But the assembly has a mental health task force that we've put together. It's in the early stages, and it's producing a directory of mental health providers. Again, right now it's not there, but it was a lot of this is in response to and seeing that the need through the COVID crisis. One thing during the crisis that was released by the task force. It was a 6-episode series, at least touching on 6 different areas of mental health. But as far as, directly what the bishops are doing as far as their clergy with mental health professionals and things like that, I can't speak to.
Okay, so Deacon Nicholas, we have this frequent communion, but maybe people don't really know how, you've sort of hinted at it, this fluctuation of within our history of not always taking communion to frequent communion and back and forth, and at least within the United States, and I think to some extent more broadly in some of the Orthodox countries around the world, there has been a move towards frequent communion. I mean, can you maybe explain a little bit why? And then somewhat related to this, so that's the first part of the question, like how did we move in that direction? But in terms of just your comment about reimagining our role as laity and clergy within the communion service, can you think of 2 or 3 practical things a parish or a parish priest or a council can do to achieve that goal, right? Can you think of 2 or 3 practical things that a parish priest or council can do to achieve that goal?
Thank you. So the liturgical renewal for Orthodoxy, in a similar sense to the churches of the West, somewhat independently, dates back to the late 19th and the early 20th century, to a return to the sources, an interest, and again, in looking at the whole of tradition, recovering that tradition, and in a certain sense, in updating the life of the church. Without going into all of the details, certainly for a long period of time, well over 1,000 years, there were brief episodes of liturgical renewal in a variety of monasteries where there was a strong exhortation to the laity of a given metropolis to participate more fully in the life of the church. But really, as we see evidence from as early as the 4th century, where you have mystagogical preaching of bishops exhorting their people to go to communion more frequently, while at the same time lamenting the fact that they're not paying attention at the service, that they're not getting what they need out of the service, that they're more interested in going to the hippodrome, which for us today would be the NFL or a concert, or sleeping in instead of going to church. So this has been a problem really for much of our history, and it wasn't until the 20th century where you have figures like, but certainly more than these, Father Alexander Schmemann, Father Elkeviadas Kalibas, and in a variety of other places in the Orthodox Church, essentially saying that, embracing a version of Eucharistic ecclesiology where when the church gathers, the church simply does what Jesus commanded and receives communion every time that there is a divine liturgy practice. And so, quite simply put, to receive communion is no longer exceptional. To receive communion now is normative. The exception would be, for some reason on this particular occasion, I'm not receiving communion, whether that be because of sickness or because of sin or some other issue that would get in the way or interfere. This didn't happen throughout the entire church, but the reason I mention the churches of the West is because they also experienced this liturgical renewal. And I think within that framework, one of the things that happened is that because it became normative, we began to expect it. And now that that has been challenged, now that we've been told that, or even if we haven't been told, but if we're thinking, there might be some kind of risk if I go up to the chalice and I'm going to take from this someone else took. The whole system itself, everything experience, everything that we've come to embrace, that this is normative, is now being challenged, and we're having to find some other kind of way to say that, well, what's the purpose of all of this, all of these liturgical services that we have? Now, as for what can be done now in the parishes, I think that there are examples of parishes that are brilliantly handling this situation. Serving divine liturgy more frequently is one example. Parishes are having liturgy more often. As I mentioned before, in some parishes, there's a divine liturgy, and then there are typica services. A typica service does not have to have communion, but it can have communion. And in some places, a deacon can lead that service, so you can have even that many more services in small groups. And I think in a situation like this, when you can have a liturgy with a small group and do so safely and do so short, because a typical service can be as short as 30 minutes or 40 minutes or 45 minutes, so that people aren't gathered together in a confined space for too long of a period of time, but that can be done safely. Beyond that, I would push the question of if parishes ask what they can. Today, a friend sent to me an example of an Episcopalian parish that's going to open its doors for students who need a little bit more than remote learning in their schools that are in the community. So if we're not using our space for liturgy, is there a way that we can use our space that simply does good in this time, that simply gives life to the community that's around us? These are the kinds of questions that I hear surfacing and that I hear people talking about. Certainly the liturgical questions, to be church as we are accustomed to, but also how can we be of service in this time to the community that's around us? So there are examples, and I think it takes that stretch of the imagination.
Thank you. So I just want to point out one comment that's come in is that IOCC, International Orthodox Christian Charities, has begun outreach to clergy regarding stress and mental health. So I just wanted to mention that program. A question or two has come in about the church and its relations with the Chinese, and I'm trying to put a couple of things together here, but I'm going to expand that and just say, how has the church dealt with the issue of some of the issues attached to the COVID crisis, like the blame that goes against Asian Americans, some of the discrimination and things like that? Has the church had any money? I'm throwing this out to anybody. Any comments on what?
Yeah, I can see a few things. I mean, I actually have a faculty appointment in China, so I have a lot of interactions. And there is a very nascent Chinese Orthodox community in some areas of China. I have heard particular bishops speak out against prejudice associated with blaming anybody for the crisis that's taken place, or anybody for the virus. Though the assembly has made a firm statement, but in my hearing, I've heard several bishops take strong stands on it.
Thank you.
So I wanted to kind of turn to the question think about this. I mean, we have to also think about the future. Gail, maybe you can correct me on this, but we're dealing with COVID right now, but there are some predictions that we could possibly face other viruses and maybe even worse sort of situations in the future. So I'm wondering, what is it? How is it that the Orthodox Church can move to a kind of reform? Like, we have one question from a participant in Georgia. I'm happy to see that we have a participant from the country of Georgia who's actually that question, like, is perhaps this mixed response to the global pandemic, could it be a pillar for reforms within Orthodox theology or within the Orthodox Church in general? I mean, could it be some kind of an occasion? And what do we need to do that? I mean, could we, how do we think about that? How do we think through those kinds of things? How do we adapt? Deacon Nicholas wonderfully kind of indicated that, through our history, there's always been movements of change as a result of changing circumstances. But how do we even kind of move towards that? Would it be helpful for theologians, a representative group of theologians and scientists, to come together and to prepare a document for a submission to the church or churches with recommendations, liturgical, theological, scientific, future outbreaks. Would those would that kind of document like that be helpful, even if it's ignored, which is not necessarily out of the realm of possibility? You know, how can the church come together perhaps to bring all the various parties together to think through and to think about, I don't know if you want to call it reform or adaptation or critically thinking ways of being faithful in the midst of change and changing circumstances. So yeah, so any one of you really, but I see Gail that you maybe want to.
I'm ready to, let me say a couple words. I'm not sure I can answer it, but I'll say a few things. Number one, this crisis was predicted in 2007 in a paper saying that a coronavirus was going to jump from bats to humans and it was going to cause a major pandemic. I mean, so this has been known for a long time, and it is being predicted that there will be many more of these coming because it's just the nature of what we have to deal with. The problem with making some sort of like global, this is how we should respond, is that how you respond to one virus is not how you respond to another, is not how you respond to another. So this novel coronavirus that we are worried about now, we need to wear masks, it's very infectious. But, you know, when influenza virus was in pandemic 100 years ago, it was, you protected yourself differently. So we can't actually say these are the criteria you should follow. This is what you must do because each virus is going to be different. But what you could do is come up with sort of a broad approach to response that might include certain categories that the church should look at and examine that would be very important. And I am not an advocate for do whatever the government says, but I do also believe that we need to be able to evaluate these situations and determine what we should do. So developing some sort of broad approach that could be used, I think that would be very useful.
Nick, Deacon Nicholas, maybe do you want to have, do you have a thought on that particular question?
Yeah, I mean, I think the church is the people too. So if people, I mean, people's voices are heard by the bishops, people speak up. And so I think if there are things that people would like to see, that's when the adaptation will start changing. So I know that sounds probably simple, but I think it's very complex because I think within the church, people often just, follow and they go with the communal way as communities are. And so voices that want to see certain changes and things happening aren't being heard, and voices that, want things to stay the same are often very loud, much louder and heard much more loudly. But I think also just expanding this idea of the COVID-19 task force, obviously not calling it maybe COVID-19 task force, but something to look at this idea of church and science. In fact, the Church and Society Committee might be going in that direction because of the pandemic and looking more towards this conversation between science and theology, science and liturgical practice and things like that. Which can maybe possibly lead to change over time, but we'll see. I mean, it's baby steps, and it's these types of things that have to stay rooted, obviously, in theologically sound tradition of the church.
Deacon Nicholas?
We're nearing the end of this program, but I wanted to ask each of you, is there a question you wished we had asked?
I'll be the first to respond. Actually, I was really interested in that last question. So what I kind of want to, I guess, close with, unless this continues on for a bit, is I've heard a number of experts who have really looked at this situation say that, a lot of what we're experiencing is certain elements of brokenness in society that already exist. And I won't get into all of them. We know many of them. We certainly know that we're new racial tensions that we're not impervious to these problems. We respond to them. And the one that I think is most important that dovetails with what both Nick and Gail were saying is trust. Like Nick said, the church is the people. And the people bring any issues that they have with trust with authority, whether that's trust with hierarchy or trust with epidemiologists or trust with government authorities, with them into the church. Now, I think that what the lesson to be taken from this is that when we look at the situation, perhaps the biggest problem of all of them has been that, in a certain sense, what's been happening exacerbates the problem of isolation, of alienation, of saying that I don't need to have anything to do with anyone who is in this orbit, or anyone who is in this church, or anyone in this religion, or anyone of this race, when it seems to be that the real need in our churches is to come out, go out the doors, have contact, and enter into dialogue with those who are around us, including those who are in authority, or those who have expertise in things that scare us, that frighten us, and especially that perhaps challenge us to change the way that we live and the way that we go about our own church lives. And so I think that that might be one of the first steps that has to be taken, is to be in dialogue, which doesn't mean simply relinquish your position, but it means to be willing to listen, to sit down, and to hear the voice of others in our community, no matter who they are, whether they're epidemiologists or whether they're the people who live in our neighborhoods and happen not to be Orthodox.
So before we end, Tony, I'll let you have the last word. I just do want to put in a couple plugs for this webinar series that the Orthodox Christian Study Center is hosting on Women Scholars of Orthodox Christianity. The next one is on August 5th at 4 p.m. with Dr. Elizabeth Fordham from Tufts University, well-known political scientist, active in the Orthodox Church in so many ways. So we hope that the participants, I just want to make participants aware of that at 4 p.m. on August 5th. That'll be the 6th in the series. But also, again, just to remind everybody of this wonderful Orthodox Theological Society of America webinar coming up on August 22nd on faith and science dialogue. I think that is something that we need right now, and it's great that OTSA is taking the lead on sort of facilitating that discussion. And Tony, I'll let you have the last word, because this is part one of I guess a two-part series. So go ahead.
Yes, thank you, Telly. And the only word I have to say is thanks. I want to give my thanks to our speakers, Gail Woloshak, Father Nicholas Denisenko, and Nick Anton. What excellent presentations and conversation today. I really, really appreciate it. I also want to thank Telly, my friend and colleague, as well as the Orthodox Christian Study Center for co-hosting this. So we look forward to the next one, which will focus on COVID-19 and challenges to the ecumenical community. And finally, I just want to thank all of you who are participating. I saw that one person joined us from Thailand. I think that's the award for the furthest away. So I want to thank all of you from around the world and around the country who have joined us today in this important conversation. Stay safe and be well.